It is an enormous pleasure and honor to host our guest today, Professor Andrew Goddard from Royal College of Physicians, London. Those of you who are from Commonwealth know the rich history of Royal College of Physicians and how much impact and influence that this Royal College and other colleges had in general health almost globally. It's actually quite fascinating. Every time when I interview somebody, they would mention something about London or physicianly things, just to sort of remind ourselves how much we are interconnected. Professor Goddard, I know that you are incredibly busy, but thank you so much for giving away some of your time to join this conversation on World Brain Day. Very good morning to you.
Good morning.
First question is, people wanted to know who Andrew Goddard is. I want you to take us as far back as possible, perhaps your primary school, perhaps high school. What influenced you to be interested in medicine? In medicine, why physician? And how did you end up as the president of Royal College of Physicians, London?
So that's a good question to start with. So I was born into a medical family, so you could argue that my genes and my environment were already set, but I tried very hard not to do medicine. I had several career ideas when I was at school, but in the end I realised that I enjoyed biology and I enjoyed being with people, and medicine really ticked both of those boxes for me. I was then really lucky. I got into Cambridge and did my undergraduate and my junior house jobs and SHO jobs in Cambridge. And that's when I first got really exposed to medicine. So I would say the first person who really inspired me was a guy called David Rubenstein, who was my consultant as a houseman. He was a physician. He first showed me that being a physician was the best of all the medical careers. And then through my junior jobs, I got a lot of exposure to gastroenterology. Was taught to endoscope by another physician called Gervais Kerrigan. And that set me on the path to gastroenterology. And I've had a number of inspiring consultants and bosses in my career. So I think what sets you on your way is who you meet. It's a lot to do with luck, chance, and where you happen to be at the right time. But it's being inspired by individuals. And I've been lucky enough to work with some great people in my career who have helped shape my career. And if it wasn't for them, I wouldn't be here now. So that got me into gastroenterology. I ended up in the Midlands in England. So I work in a place called Derby, which is smack bang in the middle of the country. And the reason I'm here is really because of my wife, who wasn't my wife at the time, but I met her when I was a junior doctor on one of the oncology wards in Cambridge. And she's from the Midlands, was coming back and said, "Are you coming?" So I made one of those life decisions, said, "Yep, okay." And it happened to be the right one. And I've loved living and working in Derby. Very friendly place, great colleagues. So another bit of advice for anybody out there is that when you're looking at where you want to work in medicine or any job, choose your colleagues very carefully, because you're going to be working with them for a long time. So I'm really lucky that I've got great colleagues. And coming to Midlands was a great move for gastroenterology as well, because it was Nottingham was one of the leading places to do gastroenterology in the world at the time when I did my research, and that sort of got me going. So then, having become a consultant, I sort of then got into college politics, and it was really through education and supporting our trainees within my hospital. I became a college tutor, whose sort of role is to look after the trainees in medicine, and that got me engaged with college life. I then realised it was something I really thought was important and I enjoyed, and I developed those skills, joined the new consultants committee at the college. Then there was a job as director of medical workforce unit. I thought, that sounds a bit dull, but I'll give it a go because I want to do more with the college. But actually, it turned out that I love dealing with data and I love learning about all the different patterns and dealing with all the different specialties. And it became one of those opportunities that I wasn't expecting that turned out to be life-changing. And through that, I then developed further, became registrar of the college, and finally ran for president 3 years ago. And here I am.
I think I remember your name as the registrar when I was sitting park once, long time ago. The Andrew, I think you touched upon quite important things that you would probably go back to when we at the latter part of our interview. You're absolutely spot on. You need to have a bit of luck. You need to have good mentors, and we are all here today thanks to blood and sweat and contribution from many, from our primary school, high school, and then medical school, then the physicians, and obviously medicine is a tough gig, whatever the subspecialty that you choose. So it is important for you to be surrounded by good people if you can make that choice. I want to spend a few minutes around Cambridge. I know that each one of us would like to say that our medical school is the best or among the best, but both Cambridge and Oxford, they are quite unique. As I hear from my colleagues, you have a peculiar way of the students being exposed to specific clinical tutors and maintaining a very sort of close relationship. Can you take us through those the early sort of formative years as medical students in Cambridge? How it was different to other medical schools? What sort of specific things that they try and do to inspire students as best as possible?
I think it's important to say that things have changed a bit, and that, as I understand it, the way that sort of medical training in Cambridge and Oxford is slightly different from how it was in my day. But in my day, you did 3 years as an undergraduate, which they still do. And within those 3 years, you get exposed to the basic medical sciences, if you like. So I did a medical sciences tripos, as it was called, and you have a director of studies, but then you have individual tutors for all those things. So we used to have sessions, and I can remember in particular my neurophysiology sort of sessions with leading research individuals in their college rooms. And so of an evening, you'd be buried away with these brilliant brains and get quizzed really hard, and it was sort of working at a level that I'd never ever had to learn. It was a really good discipline. So I think that was unique and good. That sort of, it wasn't quite 1-to-1, a 1-to-2 sort of tutoring was fantastic. But to me, it was a world I'd never experienced before. I came from a fairly simple school, and then to come to the sort of the hallowed place of Cambridge. And I think I was lucky because I really think I appreciated it, and all the opportunities it gave me. I was at St John's College, one of the biggest colleges, and so there were a lot of us medics there. But because they were quite a rich college, they supported us. I could get all the books I needed, and sort of was helped with where I was living and things. So it was a really great opportunity, and I. Whenever I go back to Cambridge, and I was lucky enough to be there last week, actually, at the clinical school graduation, I do, it makes me feel very warm in my heart. But I know that I was, as you said, I was lucky to get there. There was hard work, undoubtedly, but also a bit of luck. But if you get those sort of opportunities, you've got to take them, and you've got to make the most of them, because they don't come around very often.
Absolutely. I'm going to change the direction of this conversation slightly to a different direction. At college, you obviously have a local role promoting health and education and opportunities in the UK. You have a large membership globally. Then you also have a global role. Your members and fellows are basically all over the world, well, pretty much almost all over the world. So on one hand, you have a primary responsibility to promote health and the best health care, top quality care, the safe care, accurate care as per NICE guidelines and so on in UK. But at the same time, you do have a role to play in entire Commonwealth in different capacities in different countries. So tell us about the college structure and how you sort of try your best to be indispensable for your members and fellows locally as well as globally with the sort of same sort of rigor.
It's hard. I mean, when I got elected on a sort of a manifesto of 3 Ws, which was workforce, wellbeing, and worldwide. Because to me, the worldwide aspects of the college are really important. About 6,000 of our 40,000 members and fellows are global and are in other countries. So ensuring that we support them and we are seen as a visible entity, if you like, as the college within their own countries is really important. So we have a network of international advisors for each of the countries we are. Pre-COVID, I spent a lot of time traveling and trying to engage with different colleges and societies of physicians around the world. And it was always brilliant to meet people. And I think one of the things that I've learned in my time is that whilst we might be in different countries, we as physicians share the same ideals, the same interests, the same challenges, and we have much to learn from each other. And that's not a one-way process. It's very much a two-way process. So I've really enjoyed learning about how other physicians have tackled the challenges. One of the places that is particularly, I think, important to me is Africa, and in particular East, Central and Southern Africa, where we've been supporting them setting up a college of physicians over the past 7 years, which is going really well now. But the challenges that they've had to do with workforce are amazing. And you look at how we in the UK always say that we don't have enough doctors, but you look in parts of the world like that, and they have, almost 100 times fewer doctors than we have. So helping other groups of physicians develop, I think, is an important part for us. But also we have networks of physicians in, developed parts of the world. And, we have good links with America, Australasia, India. So I think it's a very important part of what we do. But much of it is trying to spend time and learning with each other as a way to build up those relationships.
I think you are spot on again. The pandemic has really reminded us how much we all are interconnected. And I totally agree. And last year, during the World Brain Day campaign, I was chairing last year. Also, we all felt that we probably would not be able to run a successful World Brain Day because you couldn't travel to other countries. But to my surprise, I traveled to probably 30, 40 times more countries being in lockdown, because virtually you could visit most countries. Your sleep get disrupted. And we probably had a much more successful World Brain Day campaign last year. During those virtual visits, the one thing that I learned is exactly what you said. It is give and take. There is so much to learn from colleagues from other parts of the world with the way that they go about things. And lastly, which is a nice segue to the next question, is you're absolutely right. Whichever the country or place that you are in, we all have a common agenda. We wanted to bring the best health to our patients and their families as best as we can, and using resources and choosing resources as wisely as possible to make that those decisions are economically viable and useful. This was actually the same theme that came to a couple of our head a few years back, before we didn't have a thing called World Brain Day. This was from memory around 2010, 2011, just over a cup of coffee. Just like many great things come out, we were chatting away with a couple of others that we now have the whole lot of neurological disorders contributing to significant disability worldwide. Obviously, irrespective of your specialty, brain health is important. After all, it is your brain which is letting you do things that you wanted to do. How come we wouldn't promote brain health as an overarching theme? Then someone else suggested that perhaps everyone else has this day, that day, maybe we should have a brain day. Then I think I or someone else in there were only 3 of us, so 4 of us. So they suggested that maybe we could choose World Federation Neurology Birthday. I don't know whether you know the history. World Federation Neurology was established by Lord Walton and few others in 1957, July the 22nd, in London, with 3 or 4 people, basically wanting to foster quality education and promoting sort of brain health. We were almost reinventing the same sort of a wheel, but on a slightly different agenda. But little we knew that we were targeting 100 million people, 150 million people in sort of 8 years' time. And the agenda is exactly as you said. We want to promote brain health globally in one world, as in a sort of united front. Because that matters a lot for us as humans. Now, as the president of RCP London and being involved in a global and worldly stage, when you see two massive organizations, World Federation Neurology, encompassing well over 122 countries, and Multiple Sclerosis International Federation, which is a global massive advocacy organization for multiple sclerosis, when they join hands on a common agenda to bring as many human beings as possible to promote brain health, how excited are you as a physician leader to see that two global organizations are collaborating to promote brain health worldwide?
I'm very excited. I have to be slightly careful. All the medical specialties are sort of, my children, and I can't love any one specialty more than the others. Although as a gastroenterologist, I might have slight biases. But to me, thinking about brain health is very, very important, and particularly with multiple sclerosis, I've got friends with MS, and it's one of those diseases which has a huge hidden burden, I think, and isn't really recognised by society particularly well. And in some cases, I think scares society and doesn't really. But also, when people are well and in remission, people don't know that they have multiple sclerosis. I also think that the pandemic has, been really tough for people with conditions such as multiple sclerosis, because they've had to shield the fears that come along with having a long-term condition, particularly one that affects your immune system, or you're on drugs which mean that you are perhaps at greater likelihood of getting COVID if you're on those drugs, or also the implications for vaccination. So I think it's really important to think about conditions like multiple sclerosis, raise their profile, but also from the point of view, we've made such huge strides with understanding multiple sclerosis over the past decade, with all the new treatments that have come along. We've got to continue that push, because it is, one of the leading causes of disability in the UK, particularly in young people. And I think people forget that. It might be that certainly within the UK and other parts of the world, as we develop services to manage the long-term sequelae of COVID, that might be a good thing for conditions such as multiple sclerosis, because I think it will mean there will be more rehab services. There will be more attention sort of looking at some of the subtle neurological symptoms that you might see in long COVID, but also that might mean that we pick up more cases of multiple sclerosis early and then are able to do something more about it. So I think it's quite timely. It's an important condition. And as I say, I've sort of had many patients and friends with MS. So I am excited.
Absolutely, I totally agree. What we wanted to do is, as you correctly pointed out, we made huge leaps and bounds with regard to therapeutics in multiple sclerosis. Almost stop multiple sclerosis. We have such a powerful armamentarium within neurology. But the sad truth is, nearly 70% of the world can't access them. And nearly 70% of the world can't access early diagnosis also. So what we wanted this Well Brain Day campaign is, just like we work with the World Health Organization and political leaders globally to bring vaccine availability to everybody, as we recognize that as a global burden, global issue, and we are in this together. Therefore, we want vaccines to be available to everybody. As you know, at Chatham, the G7 summit, the powerful world leaders agreed to contribute and support vaccine access globally. So our ambitious agenda is to run a massive advocacy campaign. Well, we made a lot of strides in therapeutics. There are burning issues to 70% of the world. Perhaps if we run a massive advocacy campaign by synergistically working together, all physicians, all nursing colleagues, all allied health colleagues, advocate for their government, their policymakers, supporting with the available resources, synergistically again, accessing early diagnosis and some sort of essential therapeutics that could preserve brain, perhaps we could indeed stop multiple sclerosis. So with this in mind, we created a content if you like, the content bag, which we call as World Brain Day Toolbox, has a slide deck, the whole lot of social media posts, whole lot of videos. This video would go to that collection, and the idea is those material with the connections to those links, people in whatever the country that they are in, they might use them to advocate, to promote and preserve and build services to their patients. So hence the World Brain Day campaign. And you are absolutely spot on with regard to COVID-19 and long COVID. We did a lot of work in this aspect from our own group, and we saw a strong similarity between how the COVID-19 brain response in human body and how post-stroke brain respond with whole lot of post-stroke, the complication sequelae, if you like. And you're spot on, and there are still unknown things with regard to multiple sclerosis. What actually caused it? Is it an infection? Is it the genetic immune, the connection? We know a lot, but we still need to know a lot also. As with any calamity, humans are a clever bunch of people, at least in medicine. So we learn how to work together. We found ways to get to each other's, and I'm based in Melbourne right now, and you are in London, and we are sharing ideas and having a reasonably decent conversation while we promote our synapses when doing so on both sides. So similarly, we might get additional clues to tackle these things. So that gives me the next segue to the next question. On a sort of positive spin, what would you want youngsters, whether they are in sub-Saharan Africa or the African countries where you will lay down new colleges, or Asia or America, so Australasia, what is your message to youngsters, whether they are in medicine, nursing, or allied health, but in particular medicine folks, especially in association with college?
I do a lot of ceremonies in my job as president, and it's the best bit of the job in some ways. You get to meet lots of young people who are sort of at the beginnings of their careers in their specialties, and I always get inspired and enthused. And when I see those people and I see their skill, their knowledge, their enthusiasm, I realise and I remember that medicine is brilliant, and that's a phrase that I've used for about, since I was registrar, really. And I think it's a really useful way to think about medicine. It is a brilliant career. We have such an opportunity to make a difference in people's lives. It stretches the brain. It allows us to do lots of different things. It can do whatever your skill set allows. And I think that what COVID has shown is how important medicine is, and how important healthcare is, and that relationship between doctor and patient and nurse and patient and healthcare worker and patient, and the difference that we can all make on an individual basis, but also if we all pull together and learn from each other, as we saw so clearly in the pandemic, both with the networks that were set up, but also with all the research, multi-center research studies that went on, we can achieve great things. So whilst it's been a really, really hard 18 months, and I think many people would say it's been the hardest that they've ever experienced in working in healthcare, I also think it's shown us what we are good at, what we are, why we are there. And in some ways it's re-enthused me and made me excited about the future. There are lots of challenges to face, but we've shown that clinical research can produce amazing results if it's thought about carefully and coordinated. But also, as a body of physicians, we can make a huge impact. In the UK, 90% of COVID patients in hospital being looked after physicians. So my own body of colleagues did a huge amount to improve health and look after those people. So I'm very, very proud to be a physician because of it. And to anybody starting off in medicine, the other word of advice I would give is work hard and be kind, because I think that's the other thing that COVID has sort of shown in spades, is that those people who work really hard and are kind to people are the people who will succeed in life. And it's one of those great myths of medicine that you have to somehow go around stabbing people in the back and have to have some great master plan. actually, if you work hard and you're kind, both of those things will repay themselves in great interest rates.
I think they were very wise word. I absolutely agree. The working hard and being kind, and the pandemic has really, as you epitomized, mentioning those wise words, we learned so much. Personally, I didn't believe that we would have been vaccinated by this time. I didn't think that we would be that clever to come up with a vaccine. When I saw the snippet of the Oxford vaccine producer's image on some of the news clips in the honoring event a couple of days back, you could be incredibly proud in a sort of humble way internally, being in that category of physician community, isn't it? You're absolutely right. The real competition in 21st century is how kind you are and how compassionate you are and how much you are prepared to work together with like-minded colleagues. We are in this together. This is not a national war. This is a global war. The whatever that is happening in India is going to happen in London or Melbourne, whether you like it or not. Whatever that is happening in London or Melbourne or Los Angeles, for that matter, or Addis Ababa, it's going to happen in another city the sooner or later. In fact, it happened even with Spanish flu, but it took a long time at that time. But because we are so connected, it takes hours to days now. That took the years. But on a positive note, we come a long way, and we share things quite fast. And you and me both know that we can't publish any research paper without agreeing to share our data. These days in good journals, we have to sign off that I am going to release my data for like-minded people, which is a good thing. And I think your advice is very wise for the youngsters also. I grew up in rural Sri Lanka and accidentally end up in the medical school, and then accidentally end up with most of the things that I do. But I always tell my juniors and my children that if someone rewind me to like year 7, year 6, I probably wouldn't change anything that I have done along the path. It's an incredibly satisfying journey. I'm sure it's the same for you, and it's the same for many physicians all over the world. Andrew, tell us how you spend your spare time. What are your hobbies? How do you try and find some sort of work-life balance in your day-to-day life?
So I'm lucky. I've got a family there. My kids are sort of just left university and just in the middle of university. So, but with COVID, they've been around a fair bit more, which has been quite nice. So that's been a way to relax. I cycle a lot. My two wheels is my escape, and I find that a very good way to relax. I also play a bit of golf. I don't play as much as I'd like to, and therefore I'm not as good as I'd like to be. But it's one of those games where when I'm on the golf course, I don't think about medicine at all, and I play with people who aren't doctors, which I think is very good for you. And the other thing is, people will see behind me. I'm in my study, and this is where I do most of my video calls. I quite like music, and I will enjoy losing myself in an album. And one of the things about the pandemic has been that while I've been working, not on video calls, I've been able to listen to albums in their entirety again for the first time. In an era of stream music and Spotify, I've quite enjoyed getting back to listening to an album as it was composed by an artist in its entirety, and finding some tracks that I knew 30 years ago that I've completely forgotten about. So that's what I do to relax.
I think you're absolutely right. The pandemic has given us the life that we have forgotten over a long period of time. Our backyards and some of the trees in our own garden that we did miss for a long period of time as we were busy with doing other things. Although travel is something that many of us miss, it has also given us some advantage also, isn't it?
And it's good for the planet too, actually, as well. But I think the point that you made earlier is really important, is that it has actually allowed an increased level of discussion. So I too have had many conversations that I wouldn't have had otherwise.
Mm.
I mean, I love face-to-face contact. I think there is a human thing that we need to be together, and I think that will need to develop. But I also hope that moving forward, that the hybrid of being able to talk to people through things like Zoom will stay, because I think it's really good for society and it's good for medicine.
Absolutely, I think from the healthcare point of view, I am eternally optimistic. Certain things that we learn during last 18 months are probably going to stay. Most of the events probably would be hybrid, and we now know that you could basically connect with anybody as long as there's internet and some sort of the connection. Even for these World Brain Day interviews, I went ahead and managed to interview someone who is in complete retirement, who did some original work with late Ivan MacDonald in a lab in Dunedin. Although we don't have Ian MacDonald anymore with us, I had sort of first-hand experience from the other gentleman who told me how they were trying to understand the underlying disease biology of this disorder that many of us didn't know, because many of us didn't have the luxury to know these gentlemen during their prime of their life. But as I was doing similar discussion with one of the other neurologists in USA, he told me that it looks like you are very interested in this history aspect of this. If you have time, I'll get you the connection. And this gentleman worked with Ian MacDonald during their sort of 18, 19 years of age, way before we had any idea what cause multiple sclerosis. He might be able to share some things, and he liked talking, and I'm sure that you both would enjoy. And those are some of the advantages of this new technology that we learn. Andrew, thank you so much for giving us your time. Your college is a key player in promoting health globally, and even in Australasia. When I read history of some great men and women, the contribution from your college during their formative years and as they learn through the process is immense. And it goes without saying that the rest of the other countries in Commonwealth, how much impact the college and college-related activities had. So continue to do that work and continue to be global. And as I said, not only brain health, everything health, we are in this together. And thank you very much, and stay safe and stay well. And we look forward to catching up with you face to face one day when we come out of the other end, hopefully as winners.
I hope so. It's been lovely to talk. Thank you very much.
Take care, Andrew. Stay well and stay safe. Bye now.